Thank you, Madam Chair, and I agree with you. We need to do this together, work together. We have the Vice Chair here, so she's riding herd on all of us as she is with the Chair. So we are hopeful that we have a successful result. Dr. Tabak, thank you for being here and for your role in performing the functions as NIH Director. Really appreciate this. You've done this since December 2021 and have helped steer NIH through some interesting times. Maybe you'll write a book or something. Dr. Volkoff, thank you. Dr. Hodes, thank you. Dr. Gordon and Dr. Lowy, thank you for being here today to discuss some of the biggest health issues facing our nation. This is an important opportunity for us to hear about the NIH budget proposal and better understand the priorities for fiscal year 2024. I've mentioned before that our jobs will be more challenging this year, given the debt ceiling and fiscal challenges that face our nation. Support and funding for biomedical research at NIH has long been a bicameral, bipartisan priority. The budget proposes $48.8 billion in discretionary spending for NIH, including 21st Century Cures and ARPA-H. NIH funding has seen almost a 60% increase for the last 8 years, and these investments are good reasons, are for good reasons, since NIH research affects every American in every way. As I look through the dice, I think of all the people that I know in my home state who are affected by your different disciplines. In West Virginia, NIH supports 952 jobs and $142 million in economic activity during 2022 alone. Through the $49 million that were received in grants and contracts. This year, we need to prioritize areas of agreement, such as funding to find cures and treatment for cancer, including childhood cancer, and funding for our academic research institutions. For example, in the fiscal year 2023 omnibus, we reauthorized the Childhood Cancer STAR Act, which I led with Senator Jack Reed and included in there $30 million to continue to implement it. The Cancer STAR Act directs the National Cancer Institute to advance childhood cancer research, better understand and track the disease, and enhance support for survivors and those affected by childhood cancer. Childhood cancers are different than adults, and this specialized research is very important. West Virginia ranks above the national average, both in new cancer diagnoses and deaths. So I'm pleased that the budget devotes increases to the Cancer Moonshot and significant resources to the Advanced Research Project Agency for Health, or ARPA-H, to focus on finding cures and treatments for cancer. Another area I greatly support is for the NIH Institutional Development Award, or the IDEA program. There have been few programs as impactful to my state as the IDEA program, and I'm disappointed that these awards are flat funded in the President's budget. West Virginia University is one of 17 research institutions nationwide to participate in an IDEA and ECHO program that was started in 2016. The collaboration between WVU establishes pediatric clinical trials throughout the entire state of West Virginia so that doctors and patients have access to the same treatments that are available at WVU's hospital in Morgantown. WVU is also a leader in NIH COVID research. Dr. Sally Hodder with WVU is co-leading an IDEA States Consortium initiative to better understand the long-term effects of COVID. The research capabilities at West Virginia University continue to prove that our higher education institutions can compete, our West Virginia institutions can compete with any other institution in the country. I'm disappointed in some of the overall funding levels in the NIH proposed budget. First, there are no new resources specifically for Alzheimer's research in NIH, which Dr. Hodes knows is a great passion of mine. An estimated 6.7 million people 65 or older are currently living with Alzheimer's in our country, and the national cost of caring for those Alzheimer's and other dementias is estimated to reach $345 billion, not to mention the emotional costs on our families and caregivers. There's a lot of exciting research going on in this area. Alzheimer's and dementia-related research must remain a national priority. Also, substance abuse challenges or substance use challenges facing the nation basically are receiving just lip service in this budget, as the National Institute on Drug Abuse is receiving flat funding. In 2021, fatal overdoses claimed nearly 107,000 Americans. Dr. Volkoff has visited my state, and has seen firsthand how we are in the crosshairs of the opioid and addiction crisis. Dr. Hodes, I know we are anxious to have you back in West Virginia, and frankly, I'd welcome all of you to visit West Virginia, not just to see and learn, but also to enjoy the state as well and meet the dedicated professionals. I know we are dealing with a tight budget year this year, but investments in biomedical research are so important for the future of our country. Listen, I want to thank all of you for what you do. I should have started with that because you're in an exciting time for research, an exciting time for breakthroughs, and we want to support you as well as we can. So thank you.